There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
That is a decision that you doctors should be making, not a bunch of people on the internet. There is a reason that it is a doctor's decision. He or she worked hard to achieve the degree they have. They have such a large range of training that allows them to be able to access your entire medical condition, which can determine which medication you can or should be taking. There are many variables which cannot be determined here. How high is the blood pressure? What are possible causes for high blood pressure? They need to know things such as your weight, height, some idea of your diet, family history of any cardiovascular conditions, sex, activity level, etc., etc., etc. Do not use the internet for medical advice of this nature. Do not use commercials on television for your medical advice either. When you go into a doctor and say maybe I should be on this medication, you are not being a good patient if the basis is that you saw a bunch of happy people on the television taking the med. Now, if the reason you make a suggestion like this is based on your current medication is not doing what it is supposed to do and you want to consider alternatives, then you're a much better patient. The current commercials for many medications are no better than cigarette commercials on the 1960s. The drug manufacturers are just interested in making money without considering whether someone needs the drug in question. With all due respect, you must see a doctor. Cora is not a hospital. I admit we do have some actual doctors and nurses here, but none of them have met you and examined you. And they also don't know about your medical history. You cannot ask a bunch of strangers about something as serious as what prescription is best for your body. Someone online, even if they mean well, can tell you the wrong medication, which in turn could make you very sick or even kill you if you have a bad enough reaction. See a doctor in person who can examine you fully, please. Any blood pressure medicine is good as long as it lowers the blood pressure, but certain diseases require specific ones. Diabetes, angiotensin receptor blockers or ACE inhibitors. Migraine, probably tri-beta blockers. Systolic hypertension, calcium channel blockers. Post-myocardial infarctionase inhibitors and beta blockers. There are certain conditions where a few cannot be used. From personal experience, I saw a lot of hyponatremia in patients using hydrochlorothiazide in the hot summers of South India. So wouldn't use it as first line in a patient living in hot and humid weather. Beta blockers are contraindicated in severe peripheral vascular disease, breast pain, ulcers, etc., and severe COPD and asthma. Why would you only take one? In the short term you need to take enough medication, titrated responsibly by your MD or NP, to reach your BP targets. Targets are different based on other medical factors. In the medium term you can take a look at your diet and lifestyle and see if there is anywhere you can make healthy changes. Let food be thy medicine and medicine be thy food. Hippocrates. If you're talking about taking only one medication because of cost concerns, share that with your doctor. Typically older drugs are cheaper and may not be any different. E/pill A and pill B are probably cheaper as two pills than when you combine them into one pill, pill AB for convenience. I still don't understand why people continue to ask about medication and legal advice from strangers on the internet. Even if a qualified doctor suggests you some blood pressure medicine on Quora or some blog/article, he still wouldn't know your medical history, your allergies and other health issues that you might have, which might not go well with your health. Please go and ask your doctor. Have a detailed conversation with him and he will know what to prescribe you.